Hello and welcome to your Employee Benefit Open Enrollment 2021 for Strive Senior Living and V3 Capital. My name is Leandro Ribeiro and I will be reviewing your benefits available for the year of 2021. On your first page of your benefit guide, you will see phone numbers for all the carriers and their website. Also, you will see our number on the top for Highland. We are your benefit advocate. If you do have any questions, you always want to call the carrier in regards to claims, benefits, providers, and so forth. However, if you do find yourself in some questions, you're not fully understanding your benefit, if you have some claims issues, please feel free to call us at 866-740-5550, where we are available Monday through Friday from 8:30 to 4:30, and we are able to look into your questions, your claims on your behalf with the carrier and provide you a better answer or a better understanding. Moving along to the next page, you will see page 2, it talks about eligibility. If you are listening to this video, to this recording, you must be eligible for benefit. You work at least 30 hours a week. For dependent children, they can go under your coverage up to the age of 26 for medical, dental, vision. Except for the medical, if they are fully dependent up to the age of 30 in the state of Florida. If you are listening as a new hire, your waiting period is first of the month after 60 days of employment. So if you were hired today, and today is December 12th, you would be eligible on March 1st as 60 days, January 12th, then you have February 12th, and then March 1st to be your effective date of coverage. You also have COBRA continuation of coverage available to you in case you discontinue employment with V3 or Strive. You're eligible for COBRA up to 18 months of coverage on your own. You have 30 days to let your benefit administrator know that you'd like to keep your coverage after your last day of employment. The only difference is you would be paying for 100% of the cost of the premium moving forward. Page 3, like I said, this is open enrollment time. This is the time you can make any changes to add or drop coverage without any questions being asked. This is the time you can do changes with any coverages available. You can, for instance, you can do medical just for yourself and add dependents on your vision, for instance, or dental. They're all independent from one another. You don't have to follow suit, meaning that you can have just your children on the vision coverage, and if you want to have just you and your spouse on the dental, you can do so, and so forth. And this is the time to do so. I believe you have a deadline that will be provided to you. After that, you can no longer make any changes, unless if you have what we call a life event, which is that can be a family status change that can take place throughout the year, and you're allowed to make changes to your coverage accordingly, as long as you do notify your HR department within 30 days. For instance, if you get married, you can add your spouse, or you can go to your spouse's coverage. If you have a divorce, you can drop your spouse. Birth, you can add your children or child. Death of a dependent, changing your spouse's employment. If she or he gets coverage with his or her employment, she or he can drop from your coverage and go on to her or his. That's also something that can be done, as long as, again, you do take notice within 30 days of that effective date. Beneficiary designation, make sure that you'll have a person listed as your beneficiary in case you do opt to have life insurance, or if you do opt to have the HSA account in case of your death. That person will get the benefit of it. They will have access to HSA account funds, or will be the beneficiary of your life insurance benefit. On the bottom is just a quick understanding of the section 125. All these deductions are taking place pre-taxes, meaning that you pay for them before you get taxed, meaning that the government has a say on how you can make changes, and that's why You can no longer make changes after the open enrollment period. And that's what you have to have an exception, which is the life event, to make any changes throughout the year. Moving along, we have we're going to start with the medical coverage. Okay, we have 3 different plans. We have the high plan, the mid plan, and the base plan, or we'll call the low plan, which is the HSA plan. Okay, so basically, from higher cost to mid cost to lower cost. You pay more with your plan, you pay less at the provider. That's the idea. Or you pay less with your plan, with the low plan, but you end up paying more with the provider. So what I'm going to do is I'm going to go down the mid plan, the option 42, and I'm going to go start with the commonly used services right down here in the middle. Okay. Primary care physician visit, it's a $20 copay. And a specialist is a $70 copay. Specialist is a cardiologist, ophthalmologist, any specified doctor. Your primary care physician, your family doctor, OBGYN, that's considered, I'm sorry, not OBGYN, family doctor, family practice is considered your PCP, and that's a $20 copay. Whenever you see the word copay, that means it's a fixed amount. So regardless where you are with your deductible, you are going to pay just that amount. So a $20 copay, if you have not met your deductible, it doesn't matter. You will pay a $20 fixed amount for the visit itself. And the specialist goes the same way. When you see copay, you pay $70 for the visit itself. Excuse me. None of these plans require you to choose a PCP. So if you need to go to a specialist, you can go straight to a specialist. It doesn't require a referral either. So that's a pretty good benefit feature of all these plans, where you're not stranded to or stuck with one doctor. You can go to different doctors throughout the year. Preventive care services, that's your annual checkup. That's covered in full once a year. You can go to a doctor, make sure you just tell them that you're going to the doctor for your annual checkup. Do not tell that you're going to do your checkup and you have an additional issue. If that is the case, then you will be charged a copay, because now it's a diagnostic visit rather than a preventive visit, because there's nothing to prevent about, because something already has taken place. So they will check what's going on, and that will be a diagnostic visit, and a copay will apply, or a fee will apply. Telemedicine, we're going to go over that in the next page. It's a $10 copay. Urgent care, it's a $100 copay. Again, for the visit itself, $100. Emergency room, when you see DED plus coins, that means deductible plus co-insurance. That applies the same thing for a major diagnostic like a MRI or anything like that out in an independent facility outside of a hospital. Labs, it's make sure you do go to LabCorp or Quest, one of those two, not any other lab, because those are the labs within the network of Humana. X-rays, hospitalization, outpatient surgery, the same thing applies. Deductible plus co-insurance. So let's talk a little bit more about that and how that plays out. So if you're on the mid plan, for instance, and you get hospitalized, and the cost is $6,000, just for example's sake, and let's go back up to the top where you see 5,000. Okay, 6,000 minus 5,000, it's 1,000. So you will be responsible for paying the first 5,000 for the year. Now you have a difference of $1,000. That's when the co-insurance takes place, and then that difference is split with the co-insurance. In this case, on the mid plan, 50-50. So the insurance would pay $500, and you would pay the other $500. So for that hospitalization for the first of the year, you'd be out at $5,500. Now let's say that happens again, for instance, and a month later, and the hospital bill is the same amount, just for example's sake, you have $6,000. Now you already have met the $5,000 deductible. Now the difference, it will go straight to co-insurance. So the $6,000 would be split between you and the insurance again, 50%, 50%. So then you would be responsible for $3,000 on this case. However, you have already paid $5,500 for the year, and you have what we call a maximum out-of-pocket of $7,900. So once you reach $7,900 individually, you don't pay anything else for the year medically. That's why we like to put emphasis on the maximum out-of-pocket. It's like a safe net for you or your family on medical expenses. So you know that you will not spend more than $7,900 for yourself or $15,800 for your family. Once you meet that, everything else, the insurance picks up at 100%. I know we see folks, trying to get help to pay their medical bills, opening up GoFund accounts for, thousands, for $10,000s of dollars and so forth. In your case, if you need help, absolutely. However, you know that you will not pay more than this amount here, or whichever amount is listed as maximum out-of-pocket on your plan. So it's something to be aware of. Going down prescription drugs, you have different tiers on the prescription drugs. I just want to put emphasis on the base plan, the HSA plan. You do have a restricted prescription list of prescription drugs allowed on that plan. So it's something that you also want to look at if you are currently taking prescriptions and you are thinking about the HSA low plan. You definitely want to take a look at the list of drugs that are covered under that plan. And also it is deductible based. So meaning you would have to meet your deductible before the insurance pays 50% of that. So you pay the cost of it, and it's actually a negotiated cost. It's not your regular cost of the prescription plan. If you do happen to meet your deductible throughout the year, then the insurance will pay 50% of that. Also, for all three plans, there's no out-of-network, so be very careful. We like to say no before you go. So if you're looking for a provider, a doctor, a hospital, a clinic, make sure they are within the network of Humana. And the best way to do so is calling or going on the website at humana.com. Please do not call the offices directly, as they might tell you, yes, we take Humana. However, they might take it as out of network, and in your case, you don't have out of network coverage. So always know from the source itself that you are covered. So check with Humana before you go. Moving along to the next page, you will see on your benefit guide on page 5 the cost of each plan on different tiers: employee, employee plus spouse, employee plus child or children, and employee plus family. If you have one, it's the same as employee plus child. So regardless of the amount of children you have, it's the same cost. On page 6, you have what we talked about previously, telemedicine. You have that available to you through Humana. If you have a Skype or a laptop, or if you have a smartphone, you can download the app. And then whenever needed, you can call a doctor. And if you're comfortable enough, you can FaceTime that doctor. And he or she will see what's happening with you and even be able to prescribe prescription directly to your pharmacy. And once again, it's for small things, minor things like cold, flu, sore throat, especially in the time of pandemic. You want to avoid going to a doctor for minor things where you find yourself in a room, with other people that might be sick, and who knows what they might have, and just to avoid, contact with other people. I just want to clarify the telemedicine. It's a service that's provided by Humana where you speak with a certified board physician. If your doctor's office specialist or primary care physician offers a virtual visit, that's not part of telemedicine. That's their service to you that they can offer virtually, and that's a regular copay. Telemedicine is when you use the doctor on demand service and you pay that copay for the telemedicine itself. I highly recommend downloading the app and having your information there. The way it works is you call the doctor through the app, and somebody will answer the phone and ask what the issue may be. And just like going to a regular doctor's office, they might say, doctor will be with you in 5 to 10, 15 minutes. And that means they will hang up on you and then somebody will call you shortly in regards to what your issue is. And that's basically how this service works. Health savings account explanation can be found on page 7. If you are thinking on the base plan, is the HSA plan, or what we call the high deductible high plan. It comes with the HSA feature where you can open an HSA savings account. It's an account that you can put money in towards medical expenses, and it's also pre-taxed. So going through this page, you see all the features and all the benefits of having an HSA account. Page 8, we're going to go to dental coverage now, and this time dental coverage is available through Principal, not Humana. Humana is your medical carrier. Now Principal is your dental carrier and also vision. You have the PPO plan. You get 2 cleanings a year or 1 every 6 months. Excuse me. And it's 100% covered. For basic services, once you meet your $50 deductible individually, the insurance will pay 80% and you pay 20%. So basic services like fillings or simple oral surgeries, things like that, insurance will pay 80% of the cost. And for major services, it's a 50-50 co-insurance, like crowns, dentures, bridges, and so forth. Orthodontics up for your children or your child dependent up to the age of 19, it pays 50% of the cost, all up to the maximum benefit of $1,000. Okay, just keep that in mind, and that's per per person covered. You have a maximum benefit of $1,000, meaning the insurance will pay up to $1,000 in cost. So if you end up having more than that, you'll be responsible for what goes after $1,000. And down below, you have the cost on based on a semi-monthly paycheck of the dental coverage. Moving along to vision. Also, as I said, covered provided to you by Principal. You are under the VSP choice. You have an eye exam once a year or every 12 months of $10 copay. For frames, you have an allowance up to $150. If you go over that amount, you get 20% discount. On lenses, you have a $25 copay on material. Contact lenses, if medically necessary, you have a $25 copay on the material and a $60 copay on fitting and evaluation. For elective contact lenses, you have a fitting and evaluation of a $60 copay or up to a $60 copay. If you decide to go out of a network, you can do so. However, it's based on reimbursement. So for each feature, you see that it has a reimbursement of a certain value. So it's very important, if you can, to stay within the network of Principal. So again, know before you go, if you're going to see your an eye doctor or a ophthalmologist, that you know that particular practice is under the Principal coverage. And down below, you have the cost on semi-monthly paycheck. Moving along to the next page, we have what we call income protection. You have the voluntary life insurance in case of your death, as we discussed in the beginning, that you have to have a beneficiary listed. You can go on an employee based for yourself. In case of your death, the beneficiary gets the benefit. You can go in increments of 10,000. If this is your first time, you have a guaranteed issued amount without any questions asked up to 70,000, and you can do a maximum of 300,000, but that might require EOI, which is short for evidence of insurability. It's basically a medical questionnaire that might be required if you are requiring a certain amount. Once you go online, and I'll go over that in a bit, you will the EOI form will pop out, and you print that out and fill it out and submit it to your HR administrator. After the age of 65, the benefits go down 35%, and at the age of 70, an additional 15% deduction takes place on the benefit. Voluntary life can also be added to spouse. on 5,000 increments. Guaranteed amount, if this is your first time being offered, you can add your spouse up to 20,000 without any questions, any medical questionnaire. And you can do up to 100,000, but not to exceed your own coverage. So if you have a coverage on yourself of 50,000, that's the most your spouse can go up to. She or he cannot surpass your own coverage. So whatever amount you have for yourself, your spouse has the cap of that same amount, or up to 100,000, whichever comes first. Same thing for children. You can do you can add your children to life insurance after the age of 6 months and $5,000 increments to a total of 10,000. So you have 2 increments available, and that's also available online, and you'll see the cost. Since this coverage is based on age, it's entailed to each one individually. When you go online, you see the cost of search coverage, you know, how much you want to add to your benefit and how much it costs on your paycheck. So if you want to go to 50,000, you'll see how much it costs on your paycheck right there on the screen. And I'll go over that in a little bit once I'm done with the presentation, give you a more a better summary what the online coverage enrollment is. Moving along to voluntary disability rates, voluntary short disability, also employee paid, and this time is covered by MetLife. Your life insurance is covered by Principal. Your disability coverages are covered by MetLife. What is disability coverage? It's pretty much a coverage on your paycheck. In case you're unable to work, you get hurt outside the job, and you are diagnosed disabled because you're unable to do your job, you will get a 60%, up to 60% of your weekly earnings after 14 days of that diagnosis. And that can last up to 11 weeks. Excuse me. Or a benefit maximum of $1,500. So again, if you get hurt outside work, you hurt your hand, for instance, and you're unable to do your job, your function at work, you go to the doctor says, yes, you are disabled, you file a claim and you claim disability, and after 14 days of the injury or even sickness, you get a paycheck on a weekly basis based up to 60% of your weekly income, depending on how much you choose when you pick this benefit. It does have a pre-existing waiting period. If you do have something that already took place 3 months prior, that means you won't be covered for the same thing after 12 months. Moving along to, excuse me. So long-term disability is the same principle as the short-term disability, also covered by MetLife, but obviously, as the name says, on a long-term basis, it's something more severe, something more chronic, where you're unable to do your job for a longer period of time. It's also based on 60% of your income, however, on a monthly basis, up to 60% of your monthly earning or $6,000. And the benefit begins after 90 days. So it usually takes place after the short-term disability is expired. But again, you don't have to take short-term disability to have long-term disability or vice versa. They're all independent from one another. And the long-term disability can last up to the age of retirement or age of 65, whichever applies to your coverage. Also has a pre-existing waiting period of 6 to 12, meaning if you have something in the 6 months prior, you cannot be covered up to 12 months after that. So it's something to be aware of it. If it's something that already taken place, 6 months prior, that's not going to be covered on your disability. They will reject your claim. Again, just to remind you that the life insurance, the short-term disability, the long-term disability, they all are available online. And because this is based on age and income, it will be different for everyone, but you will see how much it will cost when you go online because it already has your profile set in the system. Going along to accident insurance, also employee paid by Principal. and critical illness, also employee paid with principal. Those are two insurances that are a little bit different than your normal insurance. The way I mean it is because something happened, let's say for instance, the accident insurance. If you have an accident, you can still be covered by your regular insurance. This is more like a supplemental coverage, but the difference is this is paid directly to you. So let's say you do get in an accident outside work, you can file a claim with your disability if you have to. You can, go to the hospital and use your medical insurance if you have to. That's not a problem. But also, if you do have the accident insurance through in principle, you can file a claim, and pending what has taken place under that accident, they will pay you a lump sum directly to you. A paycheck, a check with your name on it will be mailed out to you. It's up to you to do whatever you want with that money. Obviously, the purpose of that money is to help you pay with the medical expenses. But again, it's your own money. Nobody is involved. It's just between you and principal. Same thing applies for critical illness. If you are diagnosed with a critical illness, you will also get a lump sum. And then on the critical illness, you can do from, I believe, from 5,000 up to 15,000, and depending, and you see that on the online enrollment. And then if something happens, if you're diagnosed with such critical illness, the insurance will pay you a check of that amount of the benefit that you had chosen directly to you with your name on it. There's no restrictions. It's a check with your name on it, and you can do as you please. But again, it's with the purpose to help you pay with the medical expenses. Next page. Page 11 has important terms. If you see something not fully understanding what that means, you can go down to this page. And page 13 and forward is just disclosures and legal notices that we have to put on the benefit guide that you can read it on your own. But I just want to emphasize that after reviewing all this, what you want to do is wait for you'll be receiving an email in regards how to go online to enroll. Everybody will be enrolling online. And regardless if you are enrolling or not, you have to go online. So if you are declining coverage, you still have to go online to decline it. Okay? So any eligible employee for benefit has to go online. The instructions will be coming shortly through email, and how to log in and how to do so. And everything there will be explained step by step, just like how I did on this presentation. You go through medical, you can take it or decline it. You go to dental, you can take it or decline it. You can go to vision, take it, and just add your children and so forth. But make sure that at the end of the online enrollment session that you click finish. It's very important that you do click finish, and that means that you're done. You're done for the open enrollment, and further action is needed from you. Again, this ends my presentation. Thank you so much for your time in watching this. If you do have any questions, again, the phone number is 866-740-5550. Thank you for your time, and have yourself a great year.